social expert assessment. We are holding a session entitled The Social Sector, Result-Oriented Activities. And may I introduce to you Olga Golodets, Vice Prime Minister of the Russian Federation, Mikhail Abizov, Minister of the Russian Cabinet, Lenara Ivanova, Minister of Labor and Social Protection, Bashkortostan, Svetlana Makovetsskaya, Director of the Foundation of the Grani Center, Lev Yakobson, First Vice Rector of the High School of Economics, and Natalia Pochinok, Rector of the Russian State Social University. I will introduce to you the members of our discussion as they speak, and now let me make a short introduction. We really have to face a very tough time limit, so we have to be brief. Yesterday, Dmitry Medvedev said that it was necessary to be able to come up with measurements of the actual social and economic environment. This discussion of ours is really within the scope of that assignment. We know that the social sector has been faced with problems. The social budget is shrinking. The reserve fund may be depleted next year, and people's real incomes are going down. More families becoming poor, including families with children, and apart from good demographic indicators, we get an additional burden on the government budget. The number of children and families, along with the dependence of older ages, has been growing, but people are not really satisfied with the social services, as was confirmed by a recent report by the Chamber of Accounts. But we need to recognize the progress made by the social sector, trying to preserve a social peace and to improve people's well-being, to make social assistance more targeted, and to support competition in social services. Quite a number of measures to assure better access of entities to the provision of social services. A good roadmap has been adopted, and we're optimistic. But whether this policy will live up to our expectations, I think is for us to answer. We have formulated 5 questions that we would like our presenters to answer. One, as part of a project-oriented approach, we suggest that social spending should be regarded not as spending, but as investment in the development of the human capital. And the ultimate goal of social sector spending should be growth of employment. Third, these measures should increase people's satisfaction with the services. Fourth, service suppliers should formulate new governance standards. And fifth, measures should be worked out to optimize the workforce potential and optimize the social situation. As part of this effort, I'd like to give the floor to Olga Golodets, Vice Premier of Russia. Thank you very much. I'll try to be brief. Indeed, our task is always to achieve a certain result, and we have to do that in a very difficult environment amid budget restrictions. But contrary to all forecasts, we have been able to achieve good demographic results, and the growth of life expectancy is, I think, the chief achievement of all our social policy. If people live longer, this is a comprehensive indicator of a better quality of life. We have entered the group of countries with an average expectation of life of over 70 years, and that's quite a different category. Positive population growth and a decline in the death rate is what has been achieved through a very complex planning of all factors affecting the birth rate. We have a project seeking to reduce mortality from the flu, and that includes compliance with vaccination and prophylactic measures. During the flu epidemic, many employers were indeed involved in this effort, and they would take people's temperature and prevent them from coming to their office, and we were able, as a result, to reduce the death rate in the winter period. We also are doing what we can to raise the birth rate, which is almost unachievable, because only a few years later the more fertile generations of young people will really be able to give birth to more children. Last year, extracorporeal fertilization operations were performed on over 40,000 women, and those are the best welcomed children, because they were children born in families that had been trying to get them for years. And we're going to spread the practice, because we realize that the number of couples turning for such for help in such operations is something that really has an impact on other couples and families, and every program is result-oriented. In 2012, we began implementing our orphanage an adoption program. As of July 1st this year, we have 64,000 kids in the data bank, and if you visit a children's home today, you will see how the situation has changed. Our program has not only changed the environment in the children's home, but also the composition of the kids that there are. The most complex category are children that have large numbers of siblings. It's very difficult to have them adopted, and there are lots of kids with really bad diseases, and they are difficult to take care of, although we're satisfied to note that there's a trend that even sick children are adopted.
The most difficult issue that the challenge for us since after 2014 is the level of income for the population. After 2014, poverty is a sustainable trend, and the measures that still are undertaken should be strengthened. Poverty struck those who are working. This is a very special situation. Poor working people, because their wage, their salary is much lower than the real cost of labor. They are underpaid, they are undervalued, and this trend is the most menacing one. Last year, when the minimum wage was raised to 7,500 rubles, we have some plans to increase the minimal pay to make it at the same level as the subsistence level as it is envisaged by the legislation of the Russian Federation. This is related with the budget configuration, and what is most important in the current trend is the cost of labor. We spend a lot of resources and strength on general education. We spend money on higher education, but among young people, we do not have those who, after graduating from our university, we don't have those whose labor should be valued at the level of 7,500 rubles. We do the best not to have such people, but currently we have nearly 5 million people who work with a minimum minimum wage, and 1.8 million people who work in the public organizations. They depend on the budget, and they also have this minimum pay. And this is a source of a serious poverty issue. We have delays in payments. The salary is lagging behind the standard. Our pensions that are paid to retired people are of nature that is that of insurance payments, and so depending on what the person earned determines his or her level of pension. But pension payments are, so to say, delayed payments for the labor. That is something that encourage people to live and work in their country, and only in the country with high level of payment and with high levels of pensions we can create normal and efficient economy. If there is no such understanding, we see that this takes us to some other course of discussion, but we'll do our best to make labor paid as it should be paid in all areas of Russian economy. Olga Yurievna, it was such a pleasure to hear what you were saying. I think that is the most important thing and what is happening in the country. And thank you very much for very subsistence support to the so-called maternal capital, amount of money that is allocated for mothers with more than 2 children. A system of quality assessment, will that bring us closer to availability of services at good level? Mr. Abuzov. Good morning, dear colleagues. Although it's not that late in the afternoon yet, but still it's time for us to sum up our composition of the board of the government. Has just 19 months ahead to work under the current constitution, and it's time for us to sum up and to focus on things that are still to be done for the remaining time of our mandate. And in in this relation, I would like to say that truly after of the past 4 years, the executive government, the executive board is working, especially in the social sphere, have done a lot and brought this work through Olga Golodets and her team effort to a new level. The social issues have become a priority on the government agenda. With strengthened, with the powers propelling this issue, Olga Golodets is protecting, defending actually these issues, not only in a sectorial manner, but she defends the sector that we call investments in human capital. These expenditures that lead to high efficiency. This is investments for the economy of today and tomorrow, and this is something that is impossible without personnel with high educational level, without care about people who need care from the government. And this is issue number one, priority number one for the government, and I extend my gratitude as your colleague from the government because this theme has never been put at such a high level before. It's true, we argue a lot about approaches to this area. We have challenges that cannot be tackled just within a very short period of time, and even within 6 years, but we lay foundations for that and grounds for that. And one of these grounds is the publicity of social commitments made, and that made by governments, both federal and regional. Last year, we passed the law on the independent evaluation of quality of social services. Well, that was the first step, because not everything is perfect in that law, and maybe it's too early to draw conclusions, but still, I would comment on some of them. The hierarchy system that is embedded in their independent assessment of quality of social services that is envisaged in the legislation, formation of public chambers, bids, and setting up of responsible organizations that would assess the quality of expenditures and quality of services. This hierarchical system seems to be systematized and systematic, but in practice it sometimes turns at the regional level into just nothing but a technical thing, just the way it is composed. But we want more of a substantiated substantial aspect. Whom is it targeted at? That is not for the bureaucrats, that is not for governmental officers, not to assess our work, who works better or worse, but what is but people should understand, common people should understand, where the service rendered to them is rendered at a high quality level and where not. We'll give choices to people when they can choose schools or health centers, but what is the ground for them to choose? What will make them choose if they do not know, if they do not have this assessment scale? So to promote this system, we will use the mechanisms that are included in the legislative format that regulates this aspect. That was the first try, that was the first year of work, and I don't think that we need to change things radically, but something should be added to that. We need to ensure a higher quality of availability of information about services and main parameters of services offered by our institutions. We made a big step in this direction already. We have standards according to which the main indicators of educational institutions are disclosed. We also need to implement that with regards to medical institutions, and we have some practices on this area already. We also need to disclose information in machine-readable format, in a digital format, so that the formats are all unified within the regions and at the federal level. And then organizations that are to ensure mobile applications, development of mobile applications and non-governmental systems that analyze this information and aggregation would be able to have access to this database that the government collects through the tax payment and collects and stores that information. Here we need to give way to the private sector so that they offer their products to assess the quality of social services. There is demand for that, and if there is demand, there should be supply. And if we are to standardize this work, and that will be a good contribution to the law that we drafted and to the approaches that we developed. I think, Olga Yurievna, that we need to develop in this area. Nothing radical should be rearranged here, but some amendments with some supplements should be given. And on disclosing information, there's something that makes me think that we'll come to a new stage. That will not be a breakthrough, but just a new stage. In the Council on Open Data, we work with that, and Olga Golodet supports us in that, so we'll continue working in this direction. Thank you, Mikhail Abizov. Will this bring us, will independent assessment of service bring people to a high level of satisfaction? Your opinion on that? Well, without that, it is impossible to be objective in our assessments. What is to be done what should we understand? That this is something of a very fine social matter. When some of my colleagues are invited to disclose data, they said that that will be a massive outflow of people from one institution to another, that people will virtually run away from certain schools and flow into some other schools. Why the data or a unified exam at schools is not disclosed? That's a simple example of digitalized format of disclosing information so that people can assess the quality of a social service that is offered. The standard envisages that this information will be disclosed at the level of a school, but at the national level, at the regional level, we intentionally do not disclose this information. I know that some regions did that. In Moscow, they did it in Tula, in Kaluga, they disclosed this type of information at the regional level. But people began to drift from school to school, and they even said that in Moscow there will be a mass movements of people from region to region. And my colleagues from executive bodies spoke about that quite seriously. Well, another thing, teachers may manipulate the data just to fine-tune it to have better results, because nobody wants to be at the bottom. Do you mean that we have criminals working at school? I disagree with that, because that's a criminal offense to fine-tune, to fix the results. But we're still debating this. That's a good example of excessively conservative approach, because we believe that is a very sensitive matter from the social point of view. So people think that it's better for people not to be aware of truth situation, because, well, God forbid, things may happen. That's the position of some. Thank you very much, Mr. Abizov. And now I will give the floor to Lev Yakobson, the first director of the National Research Institution, the Higher School of Economics. Thank you very much, Sergei Igorovich. I would like to support Olga Golodets in the following, that social sphere now is not something that we should shed tears about. If we read the mass media, the picture is that we're on the verge of catastrophe, but that's not true. In spite of all the difficulties, the situation of the sphere, and we have comparative analysis, is quite it is quite well shaped if we compare it with other countries of comparable level of GDP per capita. But that's not something for us to enjoy success. We know that we cannot hope for higher level of expenditures on the social sphere. But with some reservations, I may say that Alexei Kudrin during the forum said that we should not raise salaries to public offices, but I would say that it's not only a bad thing to do, but this is something that impossible, not because the decision was taken, but we would break the situation, we would undermine situation in sectors. It is necessary to increase expenditures, no way out, but, and that's the most important thing, it's true that today, more than before, we see it as an imperative to increase efficiency. And what can be done here? I think that the title of our session is quite appropriate. Result-guided social sector. The results are not that well measurable, but when we are guided by something that is well measurable, we see that we can go either to the left or to the right. That happens sometimes. But being guided by results and measurable results, that's something that people do not like. That's something that doesn't fit into the spirit of social sphere. Well, we know that doctors treat patients and results may vary, but we need to have a better payback from our efforts. Approximately 25% are in deficit, and the results are not achieved the way we want them to be achieved. What can be done? We laid certain grants for that, and we see that not only buildings, facilities, equipment, stuff. This is something that doesn't bring enough satisfaction, but we have institutions that are not well formed to the end. We, in the situation when main decisions were taken, institutions were the cornerstones were built, but we cannot build them fast. First, design or project approach. We switched to that project approach. In the Higher School of Economics, we are fond of analyzing systemic programs that are offered by the government. And what is typical, not only for those that are in the social sphere, but there may be some peculiarities. Disbalance in resources. This is something that can be proved by figures. And when things when figures do not match, that's obvious. Another thing that I already mentioned, we are guided by indicators that are available. KPI, that's a wonderful idea, but statistic is very poor. It's much poorer than in other countries with a very efficient use of program approach. Or we economize on statistics, but we happen to be wasting resources when we, for instance, assess efficiency of family policy or healthcare. Well, I'm sick and tired of saying that it's not just medical support, but something else. But statistics is very meager, and we put in our programs what we have, and thus we do not fully use the potential of program approach. Our work fails in many cases, not because of lack of transparency, but because institutions virtually sit on their information without disclosing it. And besides that, it's not enough. It's meager. So we economize, we save on such things as statistics, and this will not help to increase the efficiency. Another thing about the programs, the public councils are to analyze.
Now, we looked at the social sector, not only at that, but mostly at that, and public councils are good indeed, but their opinion letters analyzing social programs so irresolute and timid, so cautious. They look like they don't want to offend anyone. That's no good. Efficiency must be raised. And then competition. There's no other method to raise efficiency than competition. The president mentioned that in his message of 2014. The share of NGOs is too small. If the competition were developed, then they would compete on an equal footing. And this entails a lot of circumstances. Not lastly, incidentally, one of the studies conducted by the High School of Economics indicates that there's regions that do have some experience of working with NGOs, and their prejudices are dispelled. Incidentally, Bashkortostan has some experience with that, but there are also requirements for NGOs. It is time for us to make certain requirements for those NGOs that are involved. So everybody has to work a lot more intensively than earlier. Thank you. And thank you for mentioning the KPIs for the project approach. But if it's not the statistical committee, then who should formulate those KPIs? Well, the statistical committee must be financed well, so that our statistics are as good as those of advanced countries. Well, but I think that the cabinet has been doing a lot by way of raising openness, and Mr. Abizov is saying we need not multiply the number of reports to be submitted by our social sector institutions. They're overburdened with reporting, and it's our task to review the entire reporting system in the social sector to see who has to report what, whether there's any duplication, and come to a uniform standard for types of social services that it is more technical, and so that it doesn't take too much time from our teachers and doctors. I quite agree, it's all very chaotic, but apart from all that, we don't use what we have, and we believe for some reason is that reporting is something that should be done on for free, but it must be funded. Now, Linara Ivanova, Bashkortostan has been mentioned, so it's over to you. Now, to pick up what Lev Jakobson has said about the efficiency of state programs, and Olga Golodets has said quite rightly that in the context of limited budget financing, government social benefits unfortunately do not rely on the average personal income data. We pay money not always to those that are in need. We employ different methods of calculation, and there are lots of questions about the efficiency of state programs. Now, more directly to the subject of our discussion. Indeed, our goal, and it seems the time has come to change things. We were not scared by the challenge, and our task was to raise the quality of service and the scope of the coverage of those services in conditions of limited funding. 2 years ago, we launched a pilot project, and what I'm telling you now is, in fact, project management. And for it to happen, the first thing we did was to set up a department for the development of the non-government sector. We realized that without KPIs for those people, we would not have achieved anything. And based on its results, starting from July 1st, 2015, we reformatted the entire social services system, and we outsourced home services to the non-government sector. We did that quickly, softly, and efficiently. Out of 167 social service suppliers, only 45 are state-owned, and 122 are non-government entities, including 61 not-for-profit organization and 61 commercial organizations. So the government is the contractor, the buyer of services that should also control execution. The government is a customer, and we also made a bet on non-profit organizations after making an analysis of the then existing non-profit organizations. We found there were none that were ready to provide services under government control. No one was willing to undertake that willingly, and the issue of voluntariness of being included in the list of government service supplies it requires a special discussion because many do not act in good faith, and it may be a dangerous factor. So we decided to rely on the existing social workers by transforming those services into non-profit organizations. And our task was not only to change the sign, but also to structure their work in a new way. And we got authoritative organizations involved, veteran councils, disabled persons councils, and councils of social workers that instituted those non-profit organizations. So the consumers of services got involved in the management of those NCOs, and throughout the process we worked in consultancy with the Ministry of Justice and the Prosecutor's Office. So in parallel, the autonomous non-profit organizations were founders of limited partnerships that were entitled to deliver paid services. In the bidding for contracts, we rely on the criterion of conformity with standards rather than cost, and we took from under the government, we took the service providers from under the government's wing, and we placed them in a low comfort zone. And if a provider delivers a service not in line with the standard, or when two well-founded complaints are received, the organization is excluded from the suppliers and providers list, and no subsidy is issued for the subsequent period. So competition began to work because they found themselves in conditions of the risk of being deprived of government subsidies. So let me just conclude with the fact we got. The quality of service improved. We found we received no complaints at all on the quality of services. Our organizations took some very good care of those old people, and so quality is difficult to measure, and people's satisfaction is difficult to measure, but we came up with independent quality assessment. We cannot see it on the bestgov.ru website, but we do receive messages from local observers, and we know that in every village that there are people who will tell us if the social workers are not doing well. And we are also using grants and off-budget sources for the delivery of additional services whose amount doubled, and the services became more accessible. The number of service recipients increased from 30,000 to 40,000 without any increase in government spending, and that in spite of the fact that those entitled to free services became more numerous. So in fact, we awakened the dormant demand for services. Such types of services, all kinds of new types of services sprang up, even some exotic ones, and it's very good, and they make good money on them. The economic effect from that was that we saved 100 million rubles, and annually the total amount of subsidies is 460 million, which is 22.6% of the entire social service in our republic. So we have thus carried out the President's assignment. The salary deficit is not growing, and we have thus made a gift of 1.2 billion rubles to the Ministry of Finance. And in 2017, we plan to make non-profit organizations service homeless persons, and we expect everybody in Ufa on October 5th, where we are going to discuss all this with experts and representatives of other regions. Thank you. Natalia, new projects need new people, and will you be able to train such specialists? Of course, 90% of the infrastructure which is in government hands is going to be transformed on the example of Bashkortostan and Perm territory, with the involvement of non-government organizations, given access to government contracts. And of course, social education is inseparably linked with that. So let me give you several ideas on where the government should invest its resources. Some 200 or even 300 universities and medium-level colleges are training social workers, and it's important for colleges and universities to work as a single educational mechanism, not only in terms of professional or educational standards, but also in order to make the entire educational environment jointly with the government customers working as one big mechanism. Best practices should be part and parcel of the educational programs, such practices that we awarded today, and that should be on the federal agenda. Otherwise, a good result is unlikely. The second point is social entrepreneurship. Should not only be the task of educational institutions, but it should be an open resource of learning, and a consortium headed by the Ministry of Labor should invest funds and attention in electronic educational tools which will enable anyone who so wish to acquire new knowledge. And let me also emphasize the importance of federal projects that combine or bring together different areas of the social sector, like Olympics project, one that combined orientation and the employment of disabled persons. This is going forward at a fast pace, and over 60 regions decided to hold Olympics championships, and in November a second national championship is going to take place for handicapped juniors. The Ministry of Industry is also involved in the manufacture of technical rehabilitation equipment and aids. And this is a project that links all players and actors and is changing the whole attitude toward the disabled and seeking to raise their activity in and employment. So this is a project carried out by several parties, and I would like you, Olga, to put that on the more pressing agenda. We are going to support this because distance learning, especially for social workers, is something we need to start and launch immediately. We have formed the social standard for social workers, the government standard for social workers. That's a very important step, and that would drastically improve the work of the social sector.
Now I would like to give the floor to Svetlana Makovecka, director of the foundation, the center Grani of Facets. And now we get to the public opinion of those who participate in social services, and you're an expert on this. What are the challenges? What are the problems? It looks like many things have been done. We have a roadmap, but what is ahead? Well, through being guided by the title of our session and representing a non-governmental organization that is present on the social service markets, we all understand that being guided by results means that we also should have an optimal point of coexistence of interest and control, but should work in the same direction. And this will allow us to work at the highest possible level. Everywhere, no matter where I go, they tend to say that in public institutions that's not possible, governmental officials say that's not possible, and business says that's of no interest to us. So if we stem from if we do whatever we can at the highest possible level, then we'll do. But at the lowest possible level, that's what is being done. What should be added to the picture that we have got already? To my mind, entrepreneurship, potential of entrepreneurs in institutions should be increased. And for that, budget institutions should revisit the list of services offered. In particular, because they just happened historically to be there on the list, for instance, in the Perm region. And I will not speak about that because I represent that region. Many services may be placed at home, and that lessens the burden on institutions. But that doesn't mean that they become cheaper. That means that the services should be rendered at a higher quality level, and they should be accompanied by the government. And one of the most important potentials here is the family potential. Family may be an economic entity, like we had orphans placed in families, then we had senior citizens placed in families, and victims of violence were placed with families. There is potential. So there is a draft of Ministry of Finance on the formation of a public order on social services. That means that we separate the governance of the assets and the consultative part and services. And this will give us additional opportunities. We need to increase the efficiency of use of financing in both directions. And I will agree also with Natalia Borisovna that one of the key spheres is the social worker, not only social worker, but those who work in social spheres, doctors, teachers, because quite often they form the quality level. And if we understand this, then we know that there will be some release of workers in social sphere, but we should treat it as a potential that should not be lost. That's why I turn to Olga Golodets in particular, that we need to include the social sphere in that sector that is called self-employment. So a released work in social sphere may be subsidized for that. It's similar to that in agriculture, and maybe there will be a pilot a pilot project may be launched that a non-governmental supplier of services may be registered. We speak with non-commercial organizations and businesses. We have three united policy: quality, availability, and assortment. Some suppliers may work on the availability of services or on the range of services with high social value. That may be done. And in this regard, we can think about a budget financing of services rendered by non-governmental suppliers and governmental public suppliers as well as an anchor pool of services around which some partially subsidized or fully paid services will be rendered. And with that, I think the interface of social services may be placed in the units of social multifunctional centers, and that will be the multifunctional centers not only for those who deliver services but who receive services as well. I'm for the independent assessment of quality. I see many difficulties there, but there are also solutions, and the solutions may be considered not only as best practices but also as benchmarks. Why in this particular regions or in that particular sector, or in that with regards to that particular service, a high level of service was offered. That should be analyzed. We need to increase the customer usefulness of services. People, all in all, are well aware why a particular service is being offered, what social result is achieved for that. Quite often, people treat social services as a free milk, but this is a subject of their responsibility. They need to choose the services in a correct way, and this is a field of joint responsibility as non-commercial organizations that should work with reference groups to enlighten them what do we envisage when we place certain services, and also responsibility of the government and commercial organizations. And administrative barriers should be reduced for institutions and non-governmental suppliers of services. Quite often, administrative barriers while doing business is applied to all spheres except for social sphere, but it is exactly in the social sphere that you have a whole knot of many things, administrative barriers generated not just by one institution, but absence of interinstitutional interaction. So we believe this is one of the main areas for the road map, and also when we act offering when we offer 10% for the availability of social services. In non-budget sphere, unfortunately, they're still not in the equal professional sphere. Well, it doesn't matter whether they enter the doctor's office free of charge without queuing, or they wait together with others, but social workers are not included on the list of those who require additional training or improvement of their skills. But if in social sphere, their sphere of work is, well, social workers, they need to be in continuous training. And the last thing that I would like to add, although I know that I'm running out of my time, well, just one more thing, that we need to include regional priorities on competitive development should be included. If you saw that report on, you may see that competition for in social sphere is priority for just in 5 regions. I think that public officers should understand that this is the only mechanism that creates conditions. Otherwise, you'll have to generate the social services on your own and do that on your own. A role of the family. We need to reassess the role of households and families that may not only be a supplier of social services, but they may form efficient solutions not only for using social services, but depending on the responsibilities that family is taking for future decisions, for future social expenditures, educational services. That will determine the efficient formation of financing and financing those who are poor and those who need in an additional manner. That is something that we should keep in focus. One speaking about the formation of family policy. Family as an efficient economic entity. Svetlana Yurievna, I think that the focus that you brought to our attention is truly important. We ran out of our presentations and contributions, and we also suggested that participants to this discussion, representative of businesses, contribute to that. And please focus on something that is topical for you. There are decision takers here sitting with us, so please. I give the floor to Lilia Kanagina. Lilia Kanagina from Kaletina from Principal of Academic Gymnasium School, Alexei Mavrin, Chair of the Social Geriatric Center, Alexei Sidnev of Senior Group, and Julia Urozhaeva, Junior Partner of McKinsey & Company. And in conclusion, I would like to ask the floor to the person who is still with us here, sitting as one of the authors of those who developed the road. No, my question is, my request is to our moderator, just give not more than 2 minutes to other speakers. Olga Batalina, just focus on your main difficulties. Thank you very much. Thank you for giving me the floor. The Academic Gymnasium School is an organization with 25 years experience. We currently function as 11 schools, several kindergartens. We function in big buildings over 2,000 square meters. And when we raised the question how to optimize our expenditures and services, we decided that we can optimize them just through networking, and that is what we're doing actively. What we have achieved over the perimeter of all our educational institutions and on the premises that with children. Ms. Kaletina, I need to intervene. I know that you are efficient, and this is proven by the fact of your existence, and that you that you are not subsidized by the Moscow government. Get straight to the challenges. We'll put it differently. We are subsidized, but we are subsidized in a very limited way, in a small volume. For us to become more efficient, and we're a very open organization, everything is done at a very high technological level. We know how much time is spent in the educational institutions. We know how our faculty work. So we know that to become competitive in the government sector, public sector, we need to have this thing as priority financing. What's the shape of it? A similar amount of money should be allocated to that of public schools. So that was the point of reference. One more thing, may I fantasize a little bit? If possible, if every child, like with maternal capital, a certificate would accompany that child, and a parent would be able to choose an educational institution, then we'll get to a higher level of schools and schooling, and if I don't believe that parents will run from one region to another. And certificate, well, the decision on certificate was taken 2 years ago, and that's something that is being introduced. Alexei Mavrin, what is to be done for you to become more efficient? We work in St. Petersburg and operate the largest network of asylums, residential houses for senior citizens. We know how much the government spends on this issue and bid for the contest. Money is the main problem. Government wants to spend money efficiently in a targeted manner, and entrepreneurs want to earn and are eager to render services. They are ready to work in the social sphere. And people want to have to enjoy services of high quality. Two solutions for that. Free competition should be complemented by interaction between the public and private sector, because currently there is a big gap between us. If private entrepreneurs are eager to render services, they run into a difficulty. How that is to be done? They there are not enough departments in the public sphere that will support this, like in Bashkortostan, yes, something of that sort. And raising awareness or becoming social entrepreneurship more popular. Social sphere is something that is not considered to be cool and tough. I was raised with the spirit that sell cars is something prestige, but social sphere is not of prestige. The more fora we have where that is, the more often you invite social entrepreneurs and people who will become more aware of the prestige of this field, and advertisement in this, more publicity for that. Well, in Moscow, we have this format, maybe of not that large scale for as in Sochi or in St. Petersburg, but we convened conferences on medical issues, and well, that's a good idea to have something of that sort for social entrepreneurs, maybe for half a day, where we can get acquainted with best social practices that will raise this topic at a different level. Well, I agree that the main forms are more on economic issues, but time has come for us to discuss humanitarian issues at a similar level, and I think that one of the forums should be completely on humanitarian development, development of humanitarian issues and social issues. I agree with that. I second with that. Alexei Sitnev, I had their association of senior group. We are non-governmental suppliers of social services, and I also direct the system, a system of residential settlements for residential places for senior citizens. We work on the PPP basis for several years. It started with procurement, and they're guided by the law 442. We have 100 people, and we can have measurables by quality and by the number. We have a very severe category group of people with severe mental disorders. Approximately in 50% of cases, the situation has not deteriorated. From the point of view of money, we render services cheaper than the public organization, from 10 to 100%. We compare ourselves against Moscow. How do? We activate people who work. That's the focal point. Multidisciplinary approach and a number of other cases, and also use of international standards. What can be done to make this method work? A lot has been done, actually, to introduce the international standards of care for people. There should be unified standards. They should be adopted at the federal level. I know that something is being done at the Ministry of Labor and Health, but there should be a clear picture of stage-by-stage introduction of standards, international standards. Second, competition. Law 442 has worked and started to work, and people began to leave public sector. Then there's counteraction, a resistance to that locally, and those suffer who do not get services. What is to be done in this area? Well, two things, I believe. First, we need to enlighten people. I don't want to complain to the anti-monopoly service, but there are some violations here. But it is important to explain the entities that 10% on socially responsible non-profit organizations, non-governmental organizations, does not include absence of entrepreneurs. Nothing was said about business. And the last thing, to develop infrastructure, the regions do not have enough money, and government is not the most efficient manager or creator in this way. So there should be federal support for entities who want to develop PPP projects in regions. Thank you very much. And PPP, that's a separate thing to be discussed. Yulia Urozhaeva, junior partner of McKinsey, please focus on challenges.
Let me start with one figure, 20%. This is how we were able to increase pass-through of patients at hospitals, and a 30% increase in patient satisfaction. Now, making an appointment by electronic means, but for people over 50 or 60, you need things printed in big print, and such tools as crowdsourcing and other tools for ministers and governors, also measures to divide flows and route flows, as well as exchange of best practices. Some regions find brilliant solutions, like an assessment of a medical worker's social portrait, or in Moscow, clinic crowdsourcing. How do you do that? Well, it's done on a project basis, and there's another very important area, that's the search for people, not only at the level of governors and ministers, but also in explaining the tools for HR work, how to find solutions, how to spread them to the entire region. Well, I don't think it's the last meeting where we meet. Now, Olga, would you like to make a conclusion? But if you have some time, could we give the floor to Evgeny Shadrin, because he has got a lot to say. Many thanks. What's been said today, we want to implement with two documents, the roadmap and the set of measures. This includes assistance to regions in comprehensive social sector financing with access to entrepreneurs and non-profit organizations. So it could be competitive procurements or subsidies, and it should be done through technologies that replace stationary hospitals. That is through an expansion of the assortment of services. We have some very good examples when non-profit organizations deliver assistance to disabled persons and others, but those services never scaled up. So owing to a restructuring of social sector servicing and the delivery of home delivery of services, the reduction of children's homes through the placement of children at foster homes, that will be one way of raising the efficiency. Now, the second technique is through education. The education of children with both government and non-government involvement. What else? The second area is support for supply. And we need to scale up the activities of non-profit organizations. And what Natalia said should be done through a system of complementary education, but also a facilitation of the emergence of new enterprises. It's all equally important to create a system of support for social entrepreneurship. There is a program to support innovation centers for the social sector. We want to scale up those centers which can help form new enterprises and can help local authorities in forming the regulatory framework in the development of the social services market. And that's a very significant tool. And there are resource centers for non-profit organization support. So non-profit organizations and social entrepreneurship are the two approaches to dealing with this goal. Of course, standards in social services and public health need to be revised, and toward the end of this year some specific proposals will be implemented. Thank you. It was a very good idea. Now let me take up 30 seconds of your time, just 2 points. The more we discuss this issue today, the more we feel the need to hold a social and humanitarian forum, and we would like to launch such a project before 2018. Secondly, as part of the steps to implement the presidential decree concerning non-profit organizations delivering social services, we need to look harder at that. I don't think all the sectors were reflected in that decree. And we have discussed a system of support for people confronted with family violence. Indeed, it's a very acute problem, but it was not mentioned in the decree. And I think we need to review the first phase of its implementation and make proposals to complement it, because quite significant areas were missing from it, and we need to think about treating the 10% quota, providing the non-profit sector with social sector services involvement. I don't think it should be a limitation. Maybe we should correct some formulations so that either the quota be expanded and business entities might take part in the activity. I know that there are some regions that have already attained the 10% level and would like to expand it, but it's not only the quantity but also the quality that has to be increased. Now, Olga and Irina, could you please sum up the results of this discussion? Thank you. I would like to thank all the colleagues for their involvement, and I think that our agenda boils down to a few promising areas, such as support and development of the non-government sector. In various sectors, the non-government sector is present in different ways. In public health, 23% of service providers are non-government organizations, and there are medical organizations that have a listing at the London Stock Exchange, and they are indeed business entities that are stable and with a clear presence in the world market, and we're going to support that. As far as geriatrics is concerned, I think it's an area where this might be of importance. Where are the limitations here? When we talk about higher efficiency, we've been moving toward it for many years, but if we were in the conditions of 2012, then the transfer of the pension fund would be $1.5 trillion higher, but the funds don't go into the social sector. If they were channeled into the social sector and its development, we could really seriously discuss the raising of standards in public health and the social sector, because when we talk about services, we mean in the first place how much it costs, and we need to standardize it and to realize how much we are ready to finance it. But in sectors when we do have such an opportunity, as we go ahead with the development of the social sector, we do raise the issue, and I can see serious prospects in social businesses. And what seems particularly promising is the sphere of recreation, health resorts, children's resorts, and this is where business is going to develop, and we indeed should be heading for a humanitarian forum and a systemic construction of institutions that will rely on non-government services. I believe that non-government services in the social sector will create serious competition and will be the driver of our development. We all know that some non-government medical institutions possess advanced and cutting-edge technologies and are staffed with very good, competent specialists. Now, we would like the open government program to really raise the prestige of social business services. We need to support it and give a priority to it. As regards independent assessment, this is a very important system for us. Indeed, what are we to do so as not to overburden the education and public health system, but have all the information that is necessary. We have come to an understanding in which of the format in which primary data is available with opportunities for experts to analyze it and process it. The mechanism of so-called rating lists is popular today, but I can hardly imagine a parent living in a big city who would not look at those rating lists before taking their kids to a school. All the 48,000 schools are rated, and we do not publish everything, though we send information to the regions so that they do additional work with those that do not perform in the best way, and that's an object for their analysis. A few weeks from now, we are going to see the open rating list of general practitioners, of physicians, that is now under preparation by experts, and that's going to be a serious input into the public health system, because all regions and all institutions will see how they are ranked relative to others. We will find out who are the best, who are the top 500 physicians in Russia, and we will thus arrive at a very important system of indicators. As regards a programmed approach, this is something we go by always, and an example of that is the recently completed kindergarten's program, which is one of the most indicative approaches. We've been able to create 1,380,000 places with no complementary funding in any of the regions, but we've been able to do a lot. We have revised all the sanitary standards, and we've held a very large-scale retraining program. I'm not saying that we've resolved all the issues in school education, but the fact that we have opened so many additional places for school kids, and 500,000 more mothers were able to go to their offices regularly. This is something that we can present as a clear result for society to see. And now we are starting a program of school construction and accepting more kids, admitting more kids to them. That's a very important project, because new educational approaches cannot be implemented in the old schools. We need 6 million more modern school places for kids. There's a serious problem of the level and standard of our teaching staff, of our faculty, school faculty. They are missing. They're not always adequate everywhere, and the problem is not just the people that carry out the program. The new professional standard for school teachers was something we adopted in the first place, and still we are faced with problems with the transfer to the new professional standards, because it's difficult to retrain all our teachers with the basics of the profession changing. We say that the ability to motivate children comes to the foreground today, and that takes a lot of learning and creates some difficulties, though surmountable. We also have problems in management, because managers themselves do require ongoing retraining. Now, Inara has mentioned the technique of identifying needs for social services. What is the document that defines it? Federal Law 442. Right, and it has a clear definition, but then what are your problems? We have problems with payments when we deal with subsidies and benefits, but then you take the methods defined by the law, and then you build your work on that. The existing documents provide the foundation for development, and locally they are not actually used, and that's a big issue, because sometimes people come to see me and tell me we need a change in the sanitation standards for kindergartens, but I have to tell them we've just done exactly that, so there's a big time lag before those new standards are actually adopted locally. So this need to follow the changes and training needs is one of the bigger tasks we have to pursue. So I thank everybody again for this substantive discussion. Thank you, Olga Yurievna. When we started, we began from the question, what is more important, people or the economy? And I'm happy that we've also taken up the issue of family well-being. So it's family well-being that we need to go by when pursuing a social policy. Thank you. See you again.